How often should older adults truly engage in sexual activity? Is there a specific, quantifiable metric, magic number, that accurately guarantees happiness, robust health, or profound connection in the post-menopausal years? The scientific data challenging these long-held cultural assumptions may genuinely surprise you. Please remain engaged until the conclusion of this discussion, as I will disclose a lesser-known clinical insight rooted in neuroscience and endocrinology that holds the potential to fundamentally re-evaluate your perception of intimacy during this later life stage. I am Dr. Lily Stones, and I have dedicated over 30 years to the specialized care of women like you, navigating the complexities of post-menopausal health and somatic well-being. Too frequently, society dismisses the concept of an active sexual life in older adults, implicitly suggesting that intimacy is an experience to be outgrown, a chapter of existence completed by a predetermined chronological age. I assure you, intimacy does not possess a biological expiration date. In fact, clinical research consistently demonstrates that sexual activity later in life confers significant, measurable benefits across both the cognitive neurological and somatic physical domains. Before we delve into the detailed medical rationale, I kindly request your support for this professional channel. If you value these evidence-based discussions, please like this video, leave a comment to share your reflections, and subscribe to ensure you receive future episodes. Together, we are cultivating a space where women can navigate aging with confidence, knowledge, and joy. Let us examine the clinical rationale for the continued relevance of intimacy as we age. You are likely familiar with the prevalent cultural myths that you are too old for sex, or that it's not the same. The reality is vastly different. Sexual well-being in later years does not diminish health in many ways. It actively enhances and preserves systemic function. The physical, psychological, and neurochemical benefits of intimacy, maintaining an active intimate life, supports both physical and emotional health through several interconnected biological pathways. Cardiovascular support and vascular health. Physically, sexual activity functions analogously to low-intensity aerobic exercise, engaging the musculature and cardiopulmonary system. It transiently elevates heart rate, promotes circulation, and thus supports cardiovascular health. Regular sexual engagement contributes to vascular flexibility and improved endothelial function over time, potentially reducing risks associated with sedentary behavior. While not a direct substitute for formal exercise, it actively contributes to cardiac engagement and systemic vascular fitness. The transient increase in heart rate and blood pressure is generally considered safe for individuals without severe cardiovascular disease. Neurochemical release and mood stabilization. Endocrinology, psychology. According to clinical data, including sources like the Mayo Clinic, sexual activity stimulates the sustained release of key neurotransmitters and hormones, a crucial neurochemical reward system activation. This notably includes endorphins, the body's natural analgesics and pain relievers, and oxytocin, the bonding hormone, which facilitates social attachment. This beneficial cascade helps to mitigate chronic stress, lowering circulating cortisol levels, reduce perceived pain thresholds, and significantly elevate overall mood. The calming, anxiolytic effect on the limbic system is profound. Sleep quality improvement, homeostasis. Many older adults experience challenges with sleep onset or maintenance, as is insomnia, a common complaint often exacerbated by post-menopausal hormonal fluctuations. The sustained hormonal release triggered by intimacy, particularly oxytocin and prolactin, promotes relaxation and muscular detensioning, and reduces systemic anxiety. This natural release of tension can directly facilitate deeper, more restorative sleep cycles and improve overall sleep architecture, which is vital for tissue repair and cognitive consolidation. Mental health and vitality, psychosocial geriatrics. Studies published by the National Institutes of Health, (NIH), consistently indicate that older adults who remain sexually active often report lower incidence rates of clinical depression and generalized anxiety disorders. The act of feeling desired, connected, and emotionally vital restores a fundamental sense of self-worth and affirms personal relevance and continued desirability, powerfully counteracting feelings of loneliness or societal invisibility. cognitive protection, and neuroplasticity. Neurology research suggests that sexual activity stimulates cortical areas associated with memory, learning, and executive function. The accompanying increase in cerebral blood flow and the release of certain hormones may promote neural plasticity. Some observational studies even propose a potential protective effect against age-related cognitive decline, such as vascular dementia or Alzheimer's disease. In this context, consider intimacy a valuable form of cerebral and psychological exercise. Emotional fulfillment and attachment security, relational psychology. Beyond the measurable physiological outcomes, there is the undeniable emotional fulfillment. Physical closeness enhances the attachment bond and relationship security between long-term partners, offering reassurance, stability, and mutual delight. This kind of intimacy nurtures a deep, enduring sense of belonging and being valued within the relational dynamic. Redefining sexual frequency. Quality over numerical metrics. When addressing the clinical question of optimal sexual frequency for older individuals, the answer cannot be reduced to a rigid numerical metric. It is fundamentally rooted in mutual satisfaction, emotional congruence, and sustained well-being. Many individuals seek a definitive, quantifiable target formula of once a week or once a month. However, the clinical truth is that no single perfect number exists. Frequency is substantially less important than the subjective quality and emotional authenticity of the intimate interaction. The joy derived from intimacy is not contingent upon meeting an external quota, but on the subjective feeling of closeness, desirability, and mutual understanding. That established, research does provide some contextual perspective regarding population averages. A study published in the National Library of Medicine focusing on adults aged 65 and above found that participants engaging in sexual activity approximately once per week tended to report higher levels of happiness and overall life satisfaction, including stronger relationship quality compared to those reporting less frequent activity. Crucially, however, the study also found that individuals who were intimate less frequently reported being equally happy and satisfied, provided their emotional connection and bond remained strong. This emphasizes that the primary metric is emotional resonance and the sustained affective quality of the relationship. For some couples, once a month may be completely fulfilling. For others, touch and closeness may occur more often, even if it does not always involve full sexual intercourse. As we age, intimacy frequently evolves and matures. Many individuals describe a valuable shift in focus from performance metrics to prioritizing emotional closeness, companionship, and tenderness. This removal of performance pressure can actually deepen relationships and, for some, increase the intrinsic desire for more frequent closeness. Overcoming common barriers and establishing new norms, it is necessary to address the real, physiological, and psychological barriers that can make intimacy challenging in later years. These obstacles are common, but they are frequently surmountable with targeted clinical and behavioral strategies. Physical limitations and chronic pain, musculoskeletal conditions such as arthritis, chronic pain e.g., lower back, or mobility restrictions can affect comfort. Many couples successfully adapt by adjusting coital positions e.g., side-lying positions, use of supportive wedges, or utilizing pillows for musculoskeletal support. The objective is to maintain closeness while protecting vulnerable joints and muscles, prioritizing comfort over strenuous positioning. Vaginal atrophy, xerosis, and dyspareunia. This is a universal post-menopausal change due to lower circulating estrogen levels, leading to tissue thinning, dryness, and reduced elasticity. Solutions are readily available and highly effective. Over-the-counter lubricants e.g. silicone-based and vaginal moisturizers can effectively restore comfort and elasticity. For persistent symptoms, often termed genitourinary syndrome of menopause, or GSM, prescription treatments, including localized low-dose hormone therapies e.g. vaginal estrogen rings, tablets, or creams, may be necessary. Do not hesitate to discuss this with your physician. It is a common, highly treatable issue with an excellent safety profile for localized use. Emotional barriers and body image, psychosocial, feelings of self-consciousness regarding an aging body or anxiety about performance can create emotional distance. The most powerful intervention is open and consistent communication. Sharing your feelings often reveals that your partner prioritizes the emotional connection and shared history far above any perceived physical imperfection. Life stressors and libido, hormonal lifestyle, caregiving responsibilities, chronic stress, elevated cortisol, or feelings of isolation can diminish libido. If you are struggling with persistent low mood or anxiety, professional support from a mental health provider, e.g., a sex-positive therapist or counselor, can be profoundly beneficial. Tending to mental well-being is an essential prerequisite for intimate vitality. The emotional core and sustaining legacy, the emotional dimension of intimacy, often becomes the most meaningful component for older adults, an anchor of trust, connection, and shared understanding. Emotional intimacy. This strengthens self-esteem and the sense of belonging. Gestures like holding hands, lingering eye contact, or mutual non-genital touch are acts of connection as vital as physical closeness. Evolutionary embrace. Recognize that changes in the body signify a new chapter, not a decline. Intimacy can be more satisfying than ever because it is rooted in authenticity, patience, and mutual care rather than external performance standards. Sustaining intimacy in later life requires a commitment to holistic health and open communication. Self-care as foundation. Regular physical activity maintains flexibility and energy. A balanced, nutrient-rich diet supports both cardiovascular and sexual health. Mental well-being practices like mindfulness lower stress and facilitate deeper connection. Vital communication. Honest, vulnerability-based conversations about needs and desires dismantle anxiety and build trust, allowing intimacy to flow naturally. The final answer. So, how often should older people be having sex? The answer is not about numbers. It is about staying connected, communicating openly, and allowing intimacy to be a source of health, joy, and love on your own terms. I leave you with this final, crucial reflection. Intimacy is not about keeping pace with anyone else's expectations. It is about honoring your body, cherishing your partner, and embracing the closeness that makes life richer at every stage. Would you like me to elaborate on the specific prescription and non-prescription options available for managing menopausal vaginal dryness and atrophy, which is often the most significant physical barrier?